purpose of a lip procedure is to insert small amounts of filler into the lip to subtly volumise. A lot of clients complain about lip lines that develop as we age, vertical lip lines. Sometimes they stretch from the nose to the top lip and below the bottom lip as well. And one of the best ways of treating lip lines is to use a lip filler to gently stretch the lips by adding a little bit of volume to the border and the body of the lip, which softens the appearance of lip lines. We use a technique to insert the lip filler. I use a technique to insert the lip filler using a micro-cannula, which involves making a little entry point with a needle just off the lip and threading the micro-cannula into the lip, and as I withdraw the micro-cannula, leave the product behind. It's a far more comfortable procedure. The lip filler has some local anaesthetic in it which numbs the area as we go along, but majority of people that I treat find the lip treatment tolerable, although one of the more uncomfortable treatments. It would be foolish to say that any treatment involving a needle of any sort doesn't involve some degree of discomfort. The lip filler works by attracting water to the area. It stays in position by absorbing its body weight in water. It's a little bit like a sponge. It sucks water into the area, which makes the area quite moisturised. So immediately after treatment, we see more swelling than the final result, which sometimes surprises clients when you show them the immediate effect in the mirror. Although invariably after a couple of weeks when the swelling has completely subsided, they do agree they quite like the swollen effect. The area will feel really numb, which can make even talking feel quite strange when the lip isn't moving as you imagine because of the numbness created by the local anaesthetic. So what I'm going to do, in order to insert the cannula with the product into the lip, I need to make a little entry point with a very small needle just off the lip edge. People often imagine a really big tube, something akin to a hose pipe. This is a tiny little soft, flexible tube. Because it's flexible, it moulds to the contour of the lip quite easily, and you can see it doesn't puncture as well. If we use a needle to put the lip fillers in, you can use about 17, 18 holes around the lip, and it does look a bit like a pincushion when you've finished. Whereas with a cannula, I think you'll agree, it really is quite smooth to look at after treatment, far more indicative of the finished result in a few days' time. Aftercare following lip treatment. So the main thing we say is don't touch the area, don't apply makeup for at least 6 hours. Because I've used a micro-cannula and I've only made 2 insertion points just off the lip edges. I've used the needle in the centre as well. Only 4 areas where bacteria can go through, but they're accessible by bacteria for a good 4 to 6 hours. So don't touch, don't put any makeup on. Makeup brushes make up all good sources of bacteria, so are your hands. But other than that, leave well alone. When you go to have a drink, if you have a drink in the next hour, because of the numbness created by the local anaesthetic in the product, they're going to feel like they're out here. So when you take a drink, you will either pour it down your front or overcompensate and put the cup straight into your mouth, and that hurts. So they are not as big as they feel. The local anaesthetic alters the perspective.